Well, spinal fusions are the most common type of spine surgery in the United States, but a lot of people have reservations about spinal fusions because they limit motion in a way that disc replacements do not. The problem is, it can be harder to find doctors in the US willing to do disc replacements. And as a result, many Americans will travel abroad for the procedure. So today we are asking if that is really necessary. Do we need to travel abroad for disc replacements? Coming up, you're going to hear from a patient who seriously considered traveling to Germany for a disc replacement. And in the end, he chose to stay in the United States. So we're going to talk to him about that decision. But we're going to start off with spine surgeon Ehsan Jazini of VSI to better understand this whole issue. Dr. Jazini, thank you so much for being here to shed some light on whether or not to travel for ADR.
Thank you for having me. I think this is a very important question, so I'm really excited to talk to you more about this.
Good. Yeah. Well, first of all, why are so many people leaving the country to get a disc replacement? And is this something that you hear a lot from your patients?
Oh yeah, I hear this all the time. Unfortunately, in the U.S., there's really two main issues. One is insurance companies in terms of reimbursements. We had the hardest time even getting these surgeries approved. There are increased implant costs. So there's a lot of factors for why you couldn't even do these surgeries. And one of the main reasons why VSI has become a leading center is because we're at a network and we can do what we call custom treatments for our patients. And we're not no longer dictated by what the insurance company allows. We do what's right for the patient. And so that's one main reason. The second reason is even as insurance companies are approving some of these replacements, surgeons are getting less reimbursement for doing a replacement. And so basically, the whole model, the incentives are malaligned in the sense that a surgeon who's in network is incentivized to actually do a fusion versus doing a replacement.
Mm.
It's more technically challenging. You need more expertise. So when you don't align the interests correctly, you're going to see what you're basically citing that fusions, the number of fusions happening in the country keeps going up. Disc replacements are slowly climbing back up again, but that is the two main reasons why you don't see as many fusions done in the U.S. and why patients for many decades have had to travel to elsewhere, especially Europe, to have their disc replacements done.
So that's really interesting. So do you hear, in your experience, do you hear that a lot of doctors will suggest something because that they're motivated by the money, by the insurance?
They weren't admitted, honestly, in that sense. But I just went to a recent conference, a spine conference, where I was showing some of the results for disc replacements, and I would say about 10% of the surgeons were really doing disc replacements routinely, and you just have to follow the numbers, follow the dollars in any field. There has to be the financial incentives has to be properly aligned for a given product to be successful. And I don't think that surgery is any different. At the end of the day, you're providing a service for patients, and the person providing it is expecting some kind of reimbursement for their hard work.
Yeah.
And so we like to completely separate those things, right? My as a surgeon, my only priority is the patient's utmost um, care, right? Their improvement of their symptoms, and how do I do it in the best way possible? And so it doesn't mean every patient gets a disc replacement in my hands. There are situations where disc replacement may not be appropriate, or there may be situations where one level has to be fused and one level has to be replaced. So we're really truly looking at the patient, understanding their goals, and trying to figure out what's the best thing for that patient. And so I'm separating out completely that notion. Okay, what can insurance approve? We can do this. I've had patients who said to me, well, I saw another surgeon and they said, well, I can just do one level replacement. I'm going to just ignore the other level. You do need the other level fixed, but I can't do it because of insurance. We can always add that on later on, right? So basically, the person is just suggesting, hey, you're going to have two surgeries instead of one because of the constraints. Some of it is just they're just constrained by the environment, right? By their insurance company or the hospital that they work for. And so that's what's beautiful about VSI. I used to be at Georgetown, at MedStar before I came here. I couldn't do those treatments there. Even if I wanted to, I couldn't get them authorized. The hospital wouldn't allow me. So it's not like a surgeon necessarily has the bad interest of the patient, but a lot of it is just societal constraints, whether it's the hospital they work for or the insurance company that that patient has.
That's really interesting insight, and it puts the onus on the patient to really do their homework and make sure that they're in the right hands. I do want to ask you why. What is it about Germany? Why Germany is? Why is that so appealing to so many to go for a disc replacement?
Very good question. So, I actually know some of the surgeons there intimately. I work with them. Because I teach for the several companies that are approved in the U.S. to other surgeons who are trying to do more disc replacement surgeries. Some of the earliest disc replacements were actually invented in Germany, and so that's where Germany and going to Germany became prominent, right? Back in the 90s. In fact, one of the other surgeons, Dr. Mornay, is in Montpellier in France, and I know them very well. What's changed in the US is as we've gone better at it, as we've improved actually some of those implants. So the earliest version was made in Germany, but the most recent version actually US doctors have developed. And now that we've had other technologies like augmented reality, robotic surgery, we've actually leaped way beyond Germany in terms of what we can do for our patients. The US is more strict, and I think it's not a bad thing that the FDA is a little bit more strict about approving implants, right? There is a happy medium, right? In Europe, there's like I think 8 or 9 different implants that are being used, versus in the U.S. it's a little bit more limited. It's only two. I think the proper medium is kind of in the middle. But ultimately, what's important for patients to realize is that you want to go to a place where the surgeon is part of a center. It's a disc replacement center. It's a center of excellence where they're doing a lot of these surgeries. It's not like they're doing one every 2 months or even one every month. That's just not enough, right? If you want to get a knee replacement or hip replacement, you're going to go to the guy who does thousands of these, right? And so the most important thing is the surgeon is doing a lot of these. They're expert in this, and this is a focus of their care. Number one. Number two, the recovery is a huge part of it, right? The um, the surgery is not a success. It doesn't stop at the operating room. It's really how the patient is doing after. So if you do a knee replacement and the person can't move their knee afterwards because they didn't do the proper recovery, that's not a successful surgery. And so you also want to be at somewhere like where we have something called enhanced recovery after surgery, where we quickly mobilize our patients within 2 hours after surgery. They're up and walking, working with a therapist. We have our own physical therapist at VSI who are trained how to rehab a patient after disc replacement so that we can actually mobilize those joints, maintain the range of motion, just like a knee replacement. So I don't advise patients to go out of the country because then they're missing out on all the recovery that's afterwards. So, right? I think the key thing is do your research. There's a lot of information out there. I've looked at different. I know there's different support groups on Facebook and other places.
Yeah.
Most patients that come see me have actually done a lot of that research and they know exactly what they're looking for. And the most important thing is the surgeon, the center, and the recovery. I think those if you combine all those three, then it helps you to sort of find the appropriate surgeon. There's few centers in this country that do a lot of these, and I recommend patients to go to one of those providers, like the ones we have at VSI, obviously. But those are the three important key points.
So, are those the three points that you give to patients when they tell you that they're considering going abroad for a disc replacement, or is there anything beyond that that you offer them advice wise when they say, "I'm going to Germany"?
Yeah, what I think is very unique about what we do here at VSI and myself is we really try to customize each level. We're not married to a specific implant or company. Every patient is not getting a replacement. I really truly value understanding what the pathology is, using augmented reality, using artificial intelligence to understand emotions. We've done a lot of research and published on this topic to figure out how much what we call physiologic motion does the patient have and what's the appropriate implant for each level. And so that's
Mhm.
where I believe we are a step beyond whether it's Germany or other centers in the country because we've done the research. We have a registry, a cervical registry. That means disc replacements that are done in our practice. Every patient has their outcome data collected. We have the same thing for the lower back with lumbar disc replacements, and we track the outcomes of our patients. So we understand where are we doing well, what are things that we can improve upon, right? So that's the other piece of it, right? Is making sure that you're part of a center where they're actually looking at their own patients, they're looking at measuring their outcomes, because that's the only way that you know that you're doing well for your patients.
So, how do Americans find a qualified doctor here in the US to do
I would
this?
say about 50% of patients, if you look at our own data, is through Google, through online, right? That's where they're doing their research. And it's usually in multiple areas. It's not like the person just researches you on Google, right? That they stop there, right? They look on Instagram, or they may go on Facebook, and then they may go on your website, or it's through family and friends. I have a lot of patients who've had surgery with me, and you know how the way it works is a person does well, then they're going to tell 20 people, right? And so that's how
Yeah.
you inherently grow your practice. But I think mass majority of patients is through online.
Yeah. And talk to me about what you do at VSI that that may be different too. With because I know you have a lot of doctors there who are working on different maybe parts of the body and working together too. Does that matter? Do you need to go to a practice where it's kind of the group is making a decision too on your
Oh, absolutely. I mean, so let's just talk about. Let me give you an example. So we have a patient who has lower back pain, and there may be one disc that's completely worn out structurally. Let's say regenerative medicine is another huge field in our practice where we do that. I do that. Some of my partners are even more experts in that area, like Dr. Barara. And so there may be, let's say, a disc in the lower back that is to the point where it needs the structural fix. A disc replacement may be a good candidate. But there may be a disc, one or two levels above that's still not that worn out. It may be a great disc where we can do regenerative treatments for that patient. And so being part of a multidisciplinary practice where we are really treating everyone individually, customizing it, and have those other things in our toolbox, right? Regenerative medicine is a very promising area, and so that's an area where having that other, a regenerative expert is immensely important.
Mhm.
Understanding if there's nerve injury involved and how much nerve pathology or issues are going on, and having a neurologist is very important. Having our own physical therapists who are experts with both regenerative treatment and also disc replacement is very, very helpful. So, 100%. I think, you know, if you're just a surgeon in working solo and just by yourself, it's really, really tough to really be successful in this. You really need a whole village and a very strong multidisciplinary practice to be able to do this right
Yeah.
and give the best care for that patient.
Great. So, Dr. Jazini, before I let you go, I have to ask you about another big decision when it comes to disc replacements that patients need to make, and that's the type of implant that's used in an ADR. Why is this type of implant so important, and what do patients need to consider? Talk to me about that. You called it ESP.
Yeah, so there's different mobile bearing core surfaces within the implants. In the U.S., there's about 8 implants now FDA approved. In the low back, only 2 are approved. There is They have different features. So some of them are more constrained, some are semi-constrained, and some of them have almost too much motion. So there are some certain implants that I don't like to use in the neck or in the lower back, and it really depends on the patient. And so that kind of goes back to one of the other points that I was talking about, where we're really using imaging and artificial intelligence to really figure out what is the appropriate amount of motion that the patient needs. There is a lot of, I know, chatter because I look at different patient groups and I talk to a lot of patients and a lot of interest around something called ESPs. These are elastomeric type cores where the added benefit or the purported benefit is shock absorption.
Hmm.
The issue has been that there are some data out of Australia, but also in the US, that those types of materials can break down. So the US, the FDA, has been hesitant to approve those type of implants in the US in the lower back because the lower back, your whole body weight is on it, and so there's a higher risk of that wearing out. So when it comes to the lower back, I use things that are a little bit more constrained and where we have much longer data to say that there's longevity with these implants. And so my recommendation right now, given the data that I see and in my own hands and in my own experience, is not to do ESP type implants in the lower back. We use it in the neck when it's appropriate for cervical disc replacement. But with lumbar disc replacement, I think the data is still not there to support their use.
Okay. All right. So what do you suggest for patients? I mean, what data do they go with? And what I mean, does it just depend on the patient?
It does depend on the patient, but we have really good data on the two lumbar disc replacements approved in the US, the Active L and the ProDisc. They have the longest track record. They've been
Mhm.
used, at least ProDisc has been used since the 90s. And I've personally seen the 30-year data out of Europe because they've done it the longest. And so my recommendation with the lower back is to use something that we have very long track record instead of using something that I still believe is still experimental and not there. And as someone who's always pushing the envelope and on the cutting edge, we still have to do what's safe and right for the patient.
Yeah, and that's a bigger argument too for staying in the US and having it done here, right?
Absolutely. I think some of the guard rails that are here in the US is still very important for patient safety. And at the end of the day, what's most important is that we do the right thing for the patient and not put them at unforeseen risks.
Yeah. Well, we are talking about traveling abroad for disc replacement. And Dr. Jazini, thank you so much for your insight. It's a really interesting topic, especially since so many people are considering doing this. So, of course, we want to get the patient perspective now, and Jenny Davis has that part of the story.
Thank you.
Jennifer Davis here with Chad Cooper. Thank you for joining us, Chad.
It's great to be here. Thanks for having me.
Of course. All right, let's get to the personal story of this. You had back pain for a long time, 12 or 13 years, I think, and you did everything under the sun to try and put off surgery. What was it about surgery that made you want to try everything else first? What was your concern?
Well, I wanted a conservative approach to care. I didn't want to go under the knife. And I had heard some stories from different people, going different places. And I wanted to do my own homework. And I'm part of the physical therapy industry. So a conservative approach to care is what I'm all about. But, exhausting all my resources and having gone down so many paths, I knew at some point I was going to have to really look at what is surgery, what is this all about, and take those next steps.
What is the problem that was driving your pain? And at some point, a doctor had recommended to you that a spinal fusion was the surgery you would need, right?
Yes. So I'm a collegiate athlete in a previous life. Played at Virginia Tech from 2000 2004. So high level. I played linebacker. So there was a lot of issues with stingers, compression of the spine via like hitting day after day. And that just caught up to me. A few years after I was done playing, it was very uncomfortable to sleep on one or both of my sides. It just depended. So I was doing a lot of rolling back and forth, and it became a thing where I just couldn't sleep at night very well, and that affected my day to day. And so I started talking to different doctors, and I'm in the healthcare industry myself, and so I had some connections. I went and spoke with a couple orthosurgeons and neurosurgeons, and a lot of them were saying, "Look, like spinal fusion is your future. That's where you're going to end up. But for now, what we can do is give you an epidural, give you an injection to really calm that area down." And that's what I was doing early on. That, along with a lot of physical therapy, for I don't know, on and off. For about 10 years, I was doing injections along with some regenerative medicine as well.
What was it about spinal fusion that didn't feel right to you or made you at least want to investigate other options?
I wanted more mobility, and from my understanding too, and having learned from my peers, I've had the surgery in the past. Uh, the levels only last so long, then they start to kind of collapse on each other. And I've heard
Right, there's pressure above and below sometimes, and yeah,
exactly, and that made me really nervous. If I was going to dish out, and this is my spine, I have one spine, right, just like one body. I wanted to make sure this was the definitive choice, and so I was doing everything I could to do more homework, to bide my time, and before I had to get that surgery, because maybe there was something I was missing. So I kept soul searching through this process.
and in that time, you mentioned you had trouble sleeping. You told me you also had weakness and difficulty moving your right arm. You had lower back pain. You ended up with a foot drop at some point. You had the trouble sleeping. You weren't working out the way you wanted to. So, I mean, your body was certainly feeling the impact, but you also said in some ways there was a benefit of waiting 10 years because during that decade, medical advancements came along and you started to hear about disc replacement. You talk about investigating a lot. What made you look at going overseas? Was that what came up first when you Googled? Had someone mentioned it to you?
Yeah, I think just over the years, and by the way, you made me feel like I was on like Humpty Dumpty or something. Like, but that's literally the way I felt. You're right. It feels like so long ago, especially I feel so good right now. It feels so long ago where I had
It's a
all those.
sad list. I mean, it's an awful list, and you're a young guy.
I know, and I wasn't one to complain, but I just felt like I got to be a complainer, a little bit. And so, yeah. So as far as looking overseas, I just heard from different people that that's what they were looking at because of the costs and savings and just, I didn't hear so much about the outcomes yet. I heard people were doing it, but I wanted to learn more about those outcomes. And, yeah, after having more experience too with some pain management providers doing what I do in business, I learned that a lot of those surgeries over there, they see the ones that fail over there. They come back, they go to these pain docs, and then they have to manage that pain from a failed surgery overseas. And then these patients end up paying an exponentially larger amount of dollars over time to try to fix what was messed up. And not to say that they couldn't get a great outcome overseas, but I wanted the best chance. And I know that we have some of the best spine surgeons in the world right in my backyard. And I'm like, why am I not like doing another search here? Because I think it was like 5 to 10 years ago, I was starting doing some surgeries and I didn't think disc replacement was happening that much around that time. And then the doctors I spoke with said, no, 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 you don't want to go that direction. But then there was more and more information coming out about it. So I just kept waiting. And I was like, I kind of want that. It just sounds like my style. I want more range of motion. I feel like that could be more lifelong for me, that kind of surgery versus 10 years, and then so I had a lot of questions that were unanswered. So I waited and did more research.
Okay, and so the good news is doing that research led you to Dr. Ehsan Jazini. He's one of my favorites, and I know one of yours. I've sent
Yes.
a number of my family members to him too. So look, your diagnosis was serious. It was degenerative disc disease. It was a bulging disc. And so did he ever mention spinal fusion, or was your conversation starting at disc replacement and figuring out how to do it?
Yeah, I also had some arthritis in there. I had just a lot of issues going on, but no, uh, Dr. Jazini from the get-go, I mean, he put up my imaging from when I took it back in 2021 when I had first, or 2020 when I first met with him, and then from like a year or two prior, and I got to see both of those images, and it was pretty neat the way it seemed really high tech for what I've seen previously. And he got to go through kind of that story of my spine over the past couple of years with me, and I got to share my symptoms. He's like, okay, here's what I see. And right away it was, a disc replacement. And he went over what two replacements would look like versus three. But he
2 levels, right?
two levels
Yeah.
versus three. Sorry, yeah, 2 levels versus three. And he made it very clear in my head based on kind of his experience. I also got to see a couple testimonials because I wanted that proof too. And just the staff in general, the team, his PA team is so strong, and everybody there, it was like it felt like family almost right away, and I needed that. I didn't want to go somewhere where I felt like I was just another patient, another number to them. I really wanted to feel like, look, if I'm going to go under the knife with someone, I want it to feel like family. And so,
and we do hear too,
yeah.
if you compare that to having to leave the country for surgery and then come back, then you're pretty far from your care team versus here. It sounds like you were able to establish a relationship, which is important as you're moving through the different steps of surgery.
100%.
What was the surgery actually like? You'd spent 10 years avoiding it. How was it in the end?
So they did such a good job explaining what this was going to be like to me and kind of the aftermath. And so I was really well prepped. But the surgery itself, I mean, I closed my eyes and I woke up and it was over kind of thing. That's what happens with anesthesia. But as I'm waking up, I definitely felt stiff, and I think it was so interesting trying to roll out and stand up because you stand up like right away almost,
Right
right?
away. Yep.
And you get moving, and my family's looking at me like, "Oh my gosh, are you supposed to be doing that?" But yes, and then the kind of after that, the first 2 or 3 days, sure, kind of rough, but after that, it really started to heal itself, and I was back to work like 2 weeks after that
Wow.
surgery, and I'm in a driving kind of job from day to day. I was doing more hybrid for the first like month, 2 months, and then I was doing a lot of physical therapy during that time. But as far as recovery, I was amazed. I recovered faster from the 3-level disc replacement than my 2-level micro discectomy in my lower back.
Wow.
By far, it was a much faster recovery time.
And we're now more than a year out, and you mentioned you were a college athlete. Like, you're a really active guy. So what does activity look like now? And I think the question that everybody has is, what's your range of motion? That's what you wondered going in as well. So what's it look like?
Well, can we start with the range of motion? Because I could almost cry after that surgery because first of all, I could sleep better at night. But my neck, I have literally
Look at
like,
you showing off,
well, I have
moving
more
it
range of
from
motion
shoulder
now.
to shoulder.
Well, I
Yeah.
have more range of motion now than I had since playing football, really, because of those limitations and that injury. So I couldn't be more happy with the range of motion. And then as far as the strength, and because I love working out, the big thing for me is I know I don't have to lift heavy weights anymore.
Because you're a weightlifter, right? That's what you wanted to.
I love lifting weights, but my spine just I don't need to do that anymore. So I'm getting super like fit and from just lifting lighter weights, and I'm getting incredible workouts. And I'm getting ready to work out with a trainer actually later today. I do it like twice a week, and then I work out on my own. But I'm working out all the time, and I'm not feeling the residual effects that I used to like post workouts, where I would just feel like a numbing arm and it'd just be achy. Then I'd put ice on my neck. Then I'm like, oh, when's surgery gonna happen? I don't want to do surgery. None of those like nights or feelings anymore. It's more like, oh my gosh, is that a little carpal tunnel there? Oh, I think that's the worst of it.
I was
know
going
what
to
I
say,
mean?
so what kind of pain, if any, do you have now?
Um, that's a good question. I think I always had difficulty sleeping on my right side, and I think now it's more it's like a dullness, right? It's not a pain, and but I can like lay there comfortably and sleep, right? But it's like getting even better as I'm working out more, which is really interesting as I build up more muscle around there. So I don't really have as I'm thinking about it, much residual other than the fact that I know I don't want to lift too heavy like
Yeah.
anymore because that's just going to put pressure on that surgical area. So I'm very careful about going anything over like, I don't know, for me, 150, 200 pounds. If I'm like benching, I can just rip out, a plate on each side and be fine. But I don't know. I'm happy because I don't feel the residual after I work out. They're good, solid workouts, and I can sleep at night. That's the most important thing.
So what's the lesson for other people? Because look, there's no regrets, right? I think your story turned out great for you. And so there's no regrets, but there can be lessons learned. So what would you say to somebody else who is either has questions about a fusion or is looking to go overseas or is
Yeah.
wondering, what do you think is the lesson?
They've probably heard this before, but definitely do your homework. Everybody's MSK musculoskeletal body is different. How we recover, how we handle different surgeries, maybe. But I think just having that relationship with the provider and going in there and having a very transparent conversation about where they are and then meeting each other at that level and that process is so important. So making sure that you connect with that provider on your level and you feel comfortable moving forward, because that's the way I felt with Dr. Jazini. He was able to answer all my questions and then some. If I didn't have that, I was not going to move forward. So
I think, yeah, your research is interesting because you definitely researched doctors. And I think you also researched procedures, and there's so much innovation in the field of spine care.
yeah.
And it's not just a disc replacement, but you had a 3-level, right? And so things are just developing so quickly. And I think that's another lesson that I take from your story is, you really opened yourself up to all the options and where the innovation was and where the field is going and how that could be useful to you. and it looks like it paid off,
Yeah,
right?
I mean, I exhausted every conservative approach you could, could probably think of, from acupuncture to dry needling to cupping, to you name it, to PRP, Prolo, and it
Yeah.
definitely, all these things, they were helpful, right? And that helped me, saved me time, right? Physical therapy saved me time to get to the day where I felt fully comfortable, because I had enough information to go ahead and say, let's do this. Let's do the surgery with Dr. Jazini, because I built this relationship. There's the trust factor equation there with him, and it felt like family and ready to go. So I couldn't be more happier with Virginia Spine Institute in my experience. I think the nervousness sometimes of it all, I question, like, oh my gosh, what am I doing? This is scary.
Like you're almost doing too much.
I looked at
Yeah.
a YouTube video of a disc replacement. Oh my Lord, that's scary looking. But no, it's just they do them all the time at the Virginia Spine Institute, and they do them well. And that's why, that's another factor too. That's why I went with them, because I knew that was in their wheelhouse.
Oh, that's awesome. Well, we got to end so you can go meet with your trainer. So, Chad, thank you so much. We really appreciate you sharing your story.
Thanks for having me.